Hello, everyone. This is Dr. Richard Fleming. Today is Sunday, September 13, 2020. We are roughly 9.5 months into the COVID pandemic. With no more information today provided by the scientific community, funded by the United States or any other government, into the treatment of COVID-19. Given the commentary over the last several months, it is apparent to me, if to nobody else, that this war on COVID-19 has essentially been surrendered with only the nuclear option being considered. That is to say, a vaccine. Well, this is what we hear from the governments and people that are encouraging us to continue to be patient. I hear something completely opposite from the physicians treating patients in their offices. These physicians believe they have anecdotal information that shows that COVID-19 can be successfully treated as an outpatient. This is a critical time for the treatment of COVID-19 patients because after the virus has had sufficient time to replicate, roughly 4 to 5 days, the disease itself changes from being something that's truly a potential outpatient treatment to something that will produce inflammation and blood clotting, requiring hospitalization and placing the patient at extreme risk of dying. This risk can't be minimized if one isn't treating the inflammation and the blood clotting. I'm here today to encourage primary care physicians who are seeing COVID patients to participate in a research study with me. You're not going to get paid for it. What you're going to get is the satisfaction of being part of the answer that the government is not itself finding an answer to. You're going to get the satisfaction of treating your patients, and if the physicians who believe their anecdotal data is correct is right, you're going to have the satisfaction of helping to participate in the treatment of COVID-19 so that we can unmask ourselves as a society, return to a relatively normal life, and realize that this is something that, like other viruses, can be treated. What I'm proposing is a COVID Independence Day, Thursday, October 1, 2020. I'm calling for physicians who are interested and their patients who are interested in participating in this to remove their masks on that day. Come into your office, obtain a PCR nasal swab, the results of which will take some time to get back, and begin a treatment regimen to determine the results of this treatment regimen in individuals that are PCR positive, that is to say, have COVID-19, and those that are PCR negative, that is to say, those who don't technically have COVID-19. From this, we will be able to determine both the safety of this treatment regimen and the efficacy of this treatment regimen. We will ask them to come into your office and let me share this screen with you. There we go. We will ask you to determine whether they're symptomatic or asymptomatic, and we will ask you to obtain a PCR test. Following that, we would ask that the patients be placed on the following medical regimen. First, hydroxychloroquine, 50 to 100 milligrams each day. We will leave that up to you and the patients, but we would ask that you record which one they receive. Hydroxychloroquine is believed to work by interfering with the attachment of COVID-19 to the virus to the cells of the body, interfering with its ability to get inside the cells and replicate. It interferes with the reproduction of the virus inside, by allowing zinc to come into the cells to interfere with the production of the virus, as well as interfering with the ability of the virus to get the capsule off itself, its envelope, which is the first step required to actually make more of the virus using your cells. It interferes with the glycoprotein 2b3a step component, thereby reducing blood clotting, and it decreases inflammation by interfering with the Toll-7 receptor, which is responsible for further inflammation. The primary cause of death in individuals who are hospitalized with COVID-19 is inflammation and blood clotting, and as you can see, hydroxychloroquine shows promise to reducing both. The second drug treatment would be a nasal spray, interferon alpha 2 beta. One spray in each nostril, twice a day. Interferon interferes with viral replication. By providing this, it shifts the immune response to the initial innate T-cell response, increasing the ability of your immune system or the patient's immune system to attack the virus, and shifts that immune system away from the development of antibodies towards the initial response to try to prevent the need for antibodies. 10 milligrams of zinc taken daily, first to allow it to interfere with the replication of the virus once the hydroxychloroquine has increased its entry, and secondly to assist with p53, which is a genetic component of the cells responsible for responding to viruses and other health problems. 400 milligrams of magnesium taken daily to assist both with the immune system and to reduce any possible concerns related to the taking of hydroxychloroquine. Fifth, we want to reduce the blood clotting tendency, so an aspirin, either a baby aspirin 80 milligrams or a standard adult aspirin of 325 milligrams, will reduce thromboxane A2 activity and therefore reduce blood clotting tendencies. And finally, azithromycin, 500 milligrams on the first day, followed by 250 milligrams on days 2 through 5. Azithromycin is not being used to reduce the tendency of a secondary bacterial infection, but in fact is being used because it has been shown to reduce Zika virus replication, and we believe it will also reduce the replication of COVID-19. With the exception of azithromycin, which is only given for 5 days, we would ask that each of these other treatments be provided for 7 days. It's usually a 7-day regimen that most viruses respond to, and we believe that COVID-19 is no different. I will include this as the initial header leader into this video so that you can look at it easily and not have to worry about going back and forth and copying it down. We want this to be easy. Now, what are we going to do with this information once we get it? Well, first off, it will be dependent upon you to send it to me. And you can do that by simply sending me a response in YouTube. That way I know that you will have seen this. None of the responses that are placed on my YouTube site are posted unless I release them. If you are a physician or you are a patient asking about trying to get to a physician, none of your messages sent to me on YouTube will be released for the general public. I will simply have them so I know who I'm communicating with and who to expect the information from. Once you've done that, I will send you an email back and allow you complete access to me to send this information. This is not me practicing medicine or providing a service. I'm simply guiding the research effort, much like the other NCT trial that I am already doing. In this instance, however, This could be the largest research investigation in the history of mankind. It's completely up to you. It will provide absolute information, allowing us to sort out who has COVID-19 and who does not have COVID-19 based upon the PCR test and what the treatment outcomes of those patients are. If you're a physician participating in this, I will include you on the authors list unless you ask me not to, and then I will, of course, honor that request. But the information you provide can be extremely helpful. Remember, I'm calling for October 1st to be COVID Independence Day. 1 week later, you will have treatment outcomes to report. And I will put that together in a treatment paper, submit it on the behalf of the physicians involved and your patients for a medical journal to publish. And because it will have this type of raw data comparing, we will also submit it for a preprint, making it available for you to show your patients. That means by the middle of October, a month from today, we will have real outcome data to share with the world, something that the federal government's NIAID, NIH, Public Health Service, Health and Human Services, FDA, CDC have failed to do. When the system fails, it's up to the people to take responsibility. And for the physicians who want to practice medicine who have been handcuffed by the system, this is your opportunity to get some badly needed answers. And for the for the politicians and patients trying to work with the physicians, this provides them the type of evidence that they need. I know I speak for all physicians when I say if there's a treatment that doesn't work and or causes harm, we don't want that around to be used. I also speak for physicians when I say that if the data shows that these treatments work, it is not up to the government or the governors or the courts or lawyers or the social media to determine what is being used. This is not about politics. This is about medicine and the treatment of patients. I thank you for your participation. I look forward to hearing from many of you. Please share this with your friends. It is time that we step forward simply unified as a group of physicians and get the answers to these questions. Thank you.